I have a question about tort reform. I've heard that tort reform could lower medical costs or keep them in check, and yet I've also heard that in areas like Dallas or Brownsville, in a state that passed tort reform, medical costs continue to rise rapidly. And my question is tort reform enough?
Thank you, sir. Congressman Toomey, you'll have the first crack at this one.
You know, I don't think tort reform is sufficient for the problems that we face with health care, but I think it has to be in the mix. Because I do think we have many, many examples of abuse of our legal system, and that does contribute significantly to cost in several ways. But let me be clear about what most of us mean by tort reform. First of all, nobody I know who advocates tort reform has ever suggested that a person who suffers from a negligent act by a physician or a hospital shouldn't be fully compensated for the cost of further health care that arises from that error. And no one's ever suggested that they shouldn't be able to recover all lost wages. So basically all economic consequences of any kind of health care negligence should be fully reimbursed with no cap. But many of us have argued, and myself included, that we ought to put a cap on the pain and suffering number, that subjective number that sometimes juries hand out like it's a lottery. Sometimes it's multi-million-dollar awards, and it is devastating. The cost is not just the direct cost that doctors and hospitals pay in medical malpractice insurance and legal bills, but it includes the cost of practicing defensive medicine. I mean, I've talked to a lot of doctors, and they may not really want to, you know, say this publicly, but they will say candidly that because of the risk of being sued, they often will order services and tests and procedures that aren't really necessary, but they do it to cover their own risk. That is a huge built-in cost that we have on our system, and we could address that. As I say, it's not the whole solution, but it's part of it. And let me just conclude by saying I think the data is pretty clear in states like Texas, where they have implemented tort reform. They have had, yes, healthcare costs have still risen, but not nearly as fast as they've risen in other places. One last point, since I don't seem to be out of time yet. Another big part of tort reform is access. It's not just about the money, but if you look in Pennsylvania, we have lost doctors. Over the last decade or so, we actually have fewer doctors today than we did before. That can't make sense. That can't be right. In survey after survey, when you do interviews of residents, the bright young men and women who are just coming out of medical school and doing their training, they come to Pennsylvania because we have some of the best training hospitals in the world. And then they leave. And they have cited in surveys that the cost of medical malpractice is part of the reason that they leave. Don't be fooled by the fact that some would suggest that it's a small percentage of total health care costs. The problem is concentrated in certain specialties. It may be true that it's not a big concern for, I don't know, maybe dentists, maybe general practitioners. But if you're delivering babies, if you're doing neurosurgery, if you're doing orthopedic work, it's a huge problem, and it's driving doctors out of Pennsylvania. It is a cost to our system, and it is discouraging people from entering the field of medicine. I want to see the best and brightest kids in our colleges still go to medical school, still want to be doctors, and I don't think we should be inhibiting them this way.
None of us want frivolous lawsuits. We have wonderful doctors. They saved my daughter's life. One study said actually that 3 out of every 4 lawsuits that are brought forward are fraudulent. That same study said, however, that only 1 out of every 10 studies that legitimately could be brought forward is ever brought forward. Now, the Government Accounting Office and the Congressional Budget Office have done 3 studies on this. And the conclusion is that the cost to health care from litigation is half of 1%. Now, the bill does address the other 99.5%. And the reason that 0.5% is not included is, well, I honestly believe every person is permitted their day in court. I can remember 5 decades ago when my mom had a probe put down into her stomach through her throat. They pulled it out 10 minutes later and she never tasted again. Nah, but she's the older generation and it wasn't life-threatening, so of course she didn't sue. And as Pat said, yes, I do understand having economic livelihoods. As a young boy, 6 years old, through malpractice somehow becomes a quadriplegic. and that we should recover, as you said, his livelihood that has been lost. But that boy will never walk again, go to the bathroom by himself again, or put his arm around a girlfriend at 18 years old. And I don't think it's incorrect to say you should have your day in court. It's what the Constitution says. I don't want the government to intervene and think the government is wise enough to say it should be $250,000. I want a jury of your peers to decide that. The GAO also finished a study where the AMA said, there may be some defensive measures being taken. But they, with the GAO, concluded that they could not find evidence of statistical worth. And the Government Accounting Office then said, in fact, it appears as though, not for avoiding litigation, that's 1 minute, but in order to enhance the revenues, according to the GAO, many of these extra tests are being done. So as you sit back and you see that those states that actually have caps have actually, per 100,000 population, approximately 50 less physicians than do those who have no caps, it begins to say, wait a moment, maybe that person deserves their day in court, and the federal government is not wise enough to say, this is what it's worth. That's what I believe. Thank you.